Sorry, we don't want to do that, do I?
Is anybody online on Zoom able to hear us?
Yeah, it's a little muffled. We can just barely hear.
Okay, we're not able to move the mic, so we'll have to be leaning in very close. If you can't hear us, please let us know. The waiter's set up here to the side of us, so we'll try to make sure people can hear us. Is that a little better?
Can you just try to speak a little closer to the microphone?
Not swallowing it, I'll give it a shot. We'll see. One thing before we get started, I do want to make sure to put out that there is public comment availability to sign up, and that's open. I will ask again when we get to that moment, that portion of the agenda. But again, I just want to make sure people know there's a sign-up sheet over there.
Here.
Mr. Freeman,
Here.
Dr. Brunzel,
Here.
Representative Fugit,
Here.
Clerk Ingram,
Here.
Mr. Weber,
Here.
Ms. Purdy,
Here.
Ms. Raines,
Here.
Mr. Root.
Here.
Thank you. Seeing we have a forum, we'll go ahead and move on to the next phase of today's agenda. And with that, we will move forward. May I have a motion to approve the adoption of today's agenda?
So moved. Second.
Motion's been made and seconded. All in favor?
Aye.
Any opposed? The motion passes. Next up is the notice of the next business meeting schedule, which will be November 4th, 2025 at 1 p.m. in the Capitol Annex at 702 Capitol Ave, Frankfort, Kentucky, 40601. Next, we'll move into the minutes. Hopefully all the commission members have had the opportunity to review the last meeting's minutes. And if so, may I have a motion to approve the minutes?
So moved.
May I have a second?
I second.
We have a motion and a second. Is there any discussion? Seeing no discussion, all in favor?
Aye. Aye.
Any opposed? Motion passes. The next part of the program is just the executive director report. A couple of updates for the commission and those who are with us. First of all, I'd like to make sure all commission members know and the public know that there will be an update to the legislature. We've been asked by the interim committee on health services to make a presentation on an update of the work of the commission for this year, and that will be September 16th at 3 o'clock at the Capitol Annex. So I just want to make sure all members are aware that that is taking place, and we've been requested to do that. The second item is the Better Without It initiative. Want to make sure the commission has authorized the use of funds for this, that currently now with universities back in session, the on-campus engagements as well as the use of student athletes is in full swing, and at some of the facilities across the Commonwealth and the campuses, those activations are back in place. So the program is up and moving forward. I'll also open it up to Mr. Allen if there's anything he wants to add in regards to the program.
I'm constantly impressed with every meeting that we have, and I'm very excited to continue to support them. Thank you.
Thank you. Next up, just to make sure that all are aware, the local reporting that has been changed is now ongoing. As we've seen and have on the agenda discussed with the website from the University of Kentucky, the changes that they have made have allowed us to be able to take that data in electronically, and that's moving forward in a supportive way. And we're having a lot of webinars, continuing engagement with communities to make sure that they're able to get the reporting in. Once the reporting is completed, we'll make sure to give a readout. We'll have just give a readout to the commission on what that looks like. So we want to make sure you all know that that's still moving forward.
Just for point of clarification, that's the reporting on the 50% of the funds that go directly to the counties, or is this the local reporting for the programs that we fund? Are those systems the same, or are they different?
This is the new updated reporting for the system for the counties and municipalities to be able to input their data. Previously, they would just send that in to us to report. That is now for them on the website where you will access into that portal and it will go through the reporting through that. So that is for the counties and localities.
Thank you.
And then the last thing that I want to make sure to mention is again a reminder that the symposium is going to be October 13th and 14th. And so there are still tickets available. We have a robust response to that. It's an outstanding program that we anticipate coming forward and being available for those present. Again, that is going to be unbelievable. The admissions cost for that is
those voted to be the contact. So,
We
that's
appreciate
fine.
you being here.
I want to thank you guys for coming to Western Kentucky. We appreciate the attention. And here in the seating here, we have a lot of our friends and colleagues, elected officials, prevention, drug court. So we all really work together. We all know each other, and we're all uniquely. It's kind of a unique area where we all do get along and really have a good partnership down here. We do serve. I serve all 7 counties in Green River, as do many of the others. And I think what we would like, or what I would like, we just want to make sure that we are best utilizing this money in the proper way, but also moving that needle. It's not often we have 18 years to work on something, which is phenomenal. And that's the lifespan of a child. So I really, really would like, if there's anything you can give us, or as far as like the grants, support, best practices, things that are working really well that we can implement here, that, I think that would be probably something that we would all need, would all really want. Because we don't want to just throw money for 18 years and then we didn't do anything and move that needle at all. So we would, any support you can give us, especially in the realm, I work mostly in prevention. We also have some great treatment folks here. Change these kids' lives in 18 years, that's a lot of money, and that's this one big opportunity. I've been doing this for 20 years, and it's probably the best opportunity we have right now to really do something spectacular here in our Green River area and Davis County that we're staying in right now. So,
Thank you very much. Any questions or any comments from any of the commission members?
One of the things that we do encourage is to think regionally, and not every city and every county be siloed in how they spend their money, but think about needs on a regional basis. A number of grantees have done that, and we've seen some success with that.
Anything from anyone online? Just want to make sure that we don't. Okay. All right. With that, we'll move forward into the next piece of business, and that's going to be the discussion of funding priorities and decisions. As we had done last year in going through this, what the staff has done is gone through the meetings that we've had across the Commonwealth as well as the commission meeting in Frankfurt, the information that you all provided based on those discussions, and we want to move forward in a way to outline the priorities and what they look like for the coming rounds of grants and what they should go through. I'm going to ask Deputy Director Halliday to go through and outline what we see and what we understood the commission's intent to be, and that way we'll be able to make sure that that is what we move forward with. So with that, we'll turn it over to Deputy Halliday.
Thank you. Can you guys all hear me online? Okay, seeing that. So you should have the document in front of you that synthesizes the things that we've been talking about over our last several meetings. The first part is the recommendation on how we'll do the 26-27 grant opportunity. We're recommending that we continue to do the 2 separate notice of funding opportunities, one for treatment and recovery and one for prevention. Having heard that there was some confusion in the crossover between prevention and recovery, we've gone through and tried to define that a little bit more clearly for this NOFO. So the definitions you'll see on this sheet are what we propose to put on the NOFO to help people choose which category they're going into. So really focusing on for treatment and recovery, projects submitted under this category should primarily focus on addressing active opioid misuse, such as linking individuals to substance use treatment or retaining individuals in substance use treatment. This may include supportive services that help build recovery capital, such as workforce development, education, family togetherness, housing, and transportation. And then on the prevention side, projects submitted in this category should primarily focus on the prevention of first-time use, provide education on substance use, and support harm reduction strategies that assist those who are unable to stop using drugs to make positive changes to improve the health of themselves, enhance community well-being, and to reduce the risk of overdose. So those are the 2 primary definitions which we hope will help people in choosing which category more appropriately. I know this was particularly confusing on the prevention side, where a lot of sort of recovery, more recovery-oriented projects were in that committee. proposed to open the notice of funding on October 1st, give it 2 weeks, and allow folks to come and ask questions at the opioid symposium on the 13th and 14th, and then open up the portal on October 15th. And then leave that portal open till December 19th, which is actually longer than the portal was open last year, even though it closes before the first of the year. But figuring this might be a nice way to let everyone enjoy their holidays instead of worrying about whether they are putting the final touches on the grants. And then the committee meetings would be held as they have been, January, February, March, with the final meeting in March to announce the awardees. Is there any question or concern about any of those?
Is there anything, Jesse, that prohibits an organization from writing one grant for prevention and one for treatment and recovery?
No, sir. We are planning to do as we did last year. If you want to put one in each category, the language that we're using to try to ensure that happens is that it should be one project, and that one project should be in one category. So they should be not substantially the same, trying to subvert, the cap and those kinds of things.
Okay, thanks.
And I'll just comment, I think there were proposals that would check all the boxes before, and then you would have to decide which committee for them to be reviewed. So it's very helpful if people write to one of those categories, right? Or choose to write to both, but separately.
Yes.
Because I think there were overlap where should this go to the treatment and recovery group or the prevention group? And we want everybody's proposal to get a full vetting of the folks on the committee and be heard and reviewed thoroughly rather than be represented down. So it's helpful if you do target your proposals to one of those areas primarily. It doesn't mean you can't do prevention and outreach if you're doing treatment, but if it's clearly treatment focused, then let's identify the project.
I'm just gonna ask the staff in the back, one of the things I've reached out to the is, can you ensure that the video person is also being able to be seen this and they're having some technical difficulties with that, so if that's a capability. If not, I understand, but that's just an asset to both.
The Zoom isn't working with the camera, but the people on the live stream can see what's going on in the room.
So then for the priorities, a lot of what we are recommending is mirrors what we had last year. We heard repeatedly in the public meetings from the community that a lot of the priorities you set last year were on target with what people have been asking for. On the document you have, there's some highlighted sections. These are the new things that we're recommending based on what we heard and what we heard you all talking about. So for the treatment and recovery grant, it would allow for treatment applications that fill a need or service gap not being met in a geographic area, as it relates specifically to treatment only. And that the emphasis will be on projects that help link and retain people in treatment or recovery, with priority given to efforts that involve supportive housing, transportation, still not allowed to purchase vehicles, but could ask for supportive costs of vehicle use. Employment support, such as recovery to work programs or workforce development, recovery community centers, family togetherness. The three new things that we heard repeatedly from you all and the public to consider would be programs that specifically address OUD and co-occurring mental illness, expanded use of peer support, and expanded use of MOUD MAT. So those three last ones that I mentioned would be the ones that we heard from the public. And I'll pause there to see if there's any discussion about whether you want to add those or don't want to add them, if you're comfortable with what we have here.
I like the addition of the three that you highlighted, and continue to support everything else included in the treatment and recovery spending priorities.
Yeah, this is Trish online. I just want to say that I agree also. I was not able to attend all of the listening sessions, but I was able to attend the one at LexArts in Lexington. And I agree, that we heard the importance of these as priorities. So I support these as well.
I'll just add that I also support them. Particularly, I think of interest is the co-occurring OUD and mental illness. I think you all know I represent Dr. Stack in the Cabinet for Health and Family Services, where also the Department of Behavioral Health is housed, and we are undergoing a multi-year initiative to create a co-occurring capable system of care, and that represents significant challenges for providers who choose to serve folks in that space and provide holistic care. And I do think that proposals that would request funding to develop a co-occurring capable system would add to our ability to address a subpopulation of those with SUD who also have chronic and persistent mental illness. It's a population that's been difficult for us to reach. I think you all know we often have a fragmented delivery system where we have mental health and substance use, but folks don't fit those boxes. And so I would support particularly that entertaining applications for those that want to address co-occurring. But also do fully support the expanded use of peer support and expanded use of MOED as co-priorities.
Well, I think the public is now aware that it is a connecting factor, and putting more emphasis on it in their grants may encourage people to accept it. A good faith in one or the other, and we know that it's overlapping.
Anyone else online? I just want to make sure. So, hearing some consensus on those issues, then prevention would, again, there's the continued focus on prevention of first-time use, which would be youth-focused in school or out of school, and maintain our definition of 26 and under as youth, and overdose reduction efforts, naloxone distribution, mobile clinical services as priorities that you had last year. The two new additions that we are recommending based on what we heard were programs that increase access to positive youth experiences or use reduction of adverse childhood experiences as a goal. That speaks to some of the things we heard about mentorship programs and things like that. And then adding in the parents, guardians, and adult-focused substance misuse education, which we heard from several people around parental education or other prevention programs that would target more of the adult population. So those would be the recommendations to add to the list of priorities for the prevention committee. Any thoughts or concerns about any of that?
I just wanted to, go ahead, Jason, sorry.
I'm done. Go ahead.
Who was talking? I just wanted to say, this will expand the types of grants that we take a look at. And I think it's a good thing because there's so many different issues that can be regarded as prevention. So I think the fact that we're expanding them will help us be a little bit more open-minded to the actual various ways to prevent opioid, even first steps and long-term issues with prevention. So I think it's a good thing to expand it and get more proposals that hopefully are doing creative and action items that get results. So I'm for it as well.
I'm not seeing anyone else come off mute, so. All right, for the grant review criteria, these are the things that you put priority on when you're looking at a grant, as whether it meets the requirements. This is really mostly the same, but we have added some language around the projects that demonstrate strong collaboration. We're being more explicit in the requirement that if collaboration is listed, applications must include letters of support, MOAs, or other documentation of that collaboration. I think we reviewed applications that way last year. We were not as explicit about it, so we're making it very clear that if you're planning collaboration, we should see some documentation of it. Again, projects that expand or enhance services or opportunities, and the definition of supplanting being discouraged for these grant dollars, that recovery housing projects must comply with the state accreditation. Projects that address or fill service gaps in particular regions will have priority. And this language at the bottom about the 25% reduction from your most recent award is the same requirement you had last year to reduce continuation funding by 25%. It's just more clearly stating what that means and trying to be clear that this is for projects that you've already received funding for those exact things, need to start seeing that step down. And then in terms of prohibited expenditures, they would remain the same. No vehicles, no purchase of land, no new construction, renovation, or permits related to construction or renovation, and no indirect costs. Any thoughts or comments about those?
I do like the inclusion of the 12-month or 24-month option.
Yeah, I will walk you through that. So we have had this request many times. This will be a big change for our process. And Hallie put together this lovely sheet describing how that would work, because it is a lot to wrap our heads around in terms of logistics. So the recommendation for multi-year grant opportunities, which we heard repeatedly from the public at all of our meetings, and we really had to stop and think about logistically how to make that work, not that there's ever been a philosophical opposition to that, but just how do we manage that logistically. So what we are recommending is that you would apply and you would choose either a 12-month grant or a 24-month grant period and supply the budget for one of those options. It would not be give me a 12-month and a 24-month. It would choose which option of budget you want. The application will remain capped at $1 million regardless of the amount of time you're asking to spend the funds in. So if you're asking for a year, you have to and you're asking for $1 million, you have to demonstrate you can spend it in a year. So then those applications that are approved, all grantees would be required to file financial reports every 6 months, and you don't get your payment until after that 6 months. So you get the first 6-month payment at the start of the grant period in July. You would file again in January. We release the second half if you're on a 12-month schedule, which is what we're doing right now. That's what we're doing. If you are on a 2-year schedule, you would get a quarter of those funds at every 6-month mark after you file your financial report. That allows us to maintain some comfort in how the money is being spent, and also it will help us with the flow of the money over the time period so that we will still open up a grant application annually every year. But if you are on a 2-year grant, you will not be able to reapply until you are in the second year of your funding. So that will impact your decision about whether or not you ask for 2 years or not. We did a deep dive into our numbers, and in 2023, more than half of our agencies asked for an extension, and of the 5 that received $1 million, 3 of them had to have 2 extensions in order to spend that money. So we don't think we're disadvantaging anyone. It's hard to spend $1 million in 12 months, and so we're asking people to think about what they need for the period that they need it for. And we're now up over 50%, I think, of our 2024 grants, even since we filled this out, have asked for extensions as well. So for the most part, half of our grants are taking at least 18 months to spend the funds anyway. Questions?
So So will it eliminate the ability to get an extension if you do write a 12-month
No.
project? So
We will still maintain the extension request, process. We will have a form, we'll do the same things we've been doing in terms of the extension. What we're hoping is it will reduce the asks for an extension because people will plan for a 2-year grant period and have more time to spend the money out.
I like it because I think it bows to the reality of what it takes to start up a program, hire staff, make sure program in place, and so I would encourage folks to use that 2-year option if indeed applicable, because what we have found, I think, is that it takes sometimes 6 to 10 months to get the staff hired, and then you've got 2 months of the program to spend out. So I hope people take advantage of it, and I think it's a balance to the reality of what it takes to set up one of these programs.
What percentage of our people are startup programs, though?
Not very high in terms of complete startup, and I don't have the breakdown exactly, but most of them have been established for a year or two, at least, some for much longer than that. But I will say that the biggest reason for us getting a request for extension is the inability to hire staff. So it's not so much that they're a startup trying to hire their first staff, it's also just bringing in new positions or new people. We're gonna ask you to vote on an extension in a little bit that's specifically related to not being able to hire someone for almost a year into their grant. So that is probably the biggest reason we get a request for extension. And so if you only have 12 months and it takes you 6 months to hire someone, we're adding another 6 to 9 months on average.
Is it not because they're able to find them, or not because they have the money?
No, it's because they can't identify the person. They can't get the,
Okay.
the position established, the application out, and then the hiring. It's taking an average of at least 3 months for most of these organizations to find the person to hire.
Okay. But some of the grants have come forward with planning to hire future people.
Yes.
We see a lot of grants that say, I'm going to hire 5 new people, or I'm going to hire XYZ. So are you talking about those situations, or are we just talking about
It's both. It's both. It's hiring new staff that they've asked for funding to extend or expand their services. So they're hiring a new peer support, which you all have been supportive of. And then it takes them an average of 3 to 6 months to get somebody hired and onboarded and actually drawing the salary down. But then some of it is, we have seen cases where they had a person identified when they put in the grant, or they had someone in the position, and then there's turnover, and then they end up having 3 or 4 months of extra salary during the vacancy while they were rehiring.
And just to add to that, that's one of the things the staff did mention. These things will come through at a high volume, and we can handle a number of it administratively, but the time that it requires for staff to deal with these are something that just doesn't need to happen. And this process will help alleviate that and get people to make sure they apply in a way that they think they're actually going to move the money.
It was a little hard to hear, Chris, but I think I heard most of it.
I won't repeat all. I'll think you took most of it in.
So that completes the list of all the things that you all have to consider, and I think we just want to make sure you all have consensus around that if there's any major concerns. If not, we'll take this and use it to draft a notice of funding to open up on October 1st.
Do me a favor, because I'm having hearing issues on my end a little bit. The things that we still continue not to pay for are vehicles, correct?
Vehicles and new construction and indirect costs.
Okay,
And
thanks.
Chris reminds me of the other piece that we want to also get your buy-in in to prep us for next year's priority setting. We are recommending that the commission establish a strategic investment work group that would start meeting in November and would meet the first 6 months of next year. One thing we've heard from you all repeatedly is, and it speaks to what our guests spoke about today in terms of lever pulling or actually moving a lever in a very specific area, putting together a work group of experts in the field that would not have necessarily a stake in the funds, right? There may be a grantee or two on there, but would be predominantly asked to look at what areas could there be a strategic investment plan outlined that the commission could fund that would move one needle a little further along. Because as we get the applications in now, I think we're moving a lot of needles, but they're moving in smaller increments. And so we would like to convene a group that's outside of the commission, but with your blessing, and anyone you want to see on that commission, you should talk to me about afterward, to try to have experts look at the data and say, bring you back a couple of proposals that would say, if we invested in this area of prevention or this area of transportation or whatever that commission work group has identified after hearing from experts and talking it over several months, to say, we think if you could make an investment in this area, you would move the needle. So it would be to do the research that it would take to figure out where some investment push would help. And we're not talking about, we're looking at modest investments over a period of time that would have a focus. So no predetermination on what that would be, but just trying to get folks from public health and around the state convene to talk about it and think about what that strategic investment, lever pulling, as we call it in the office, where that area might be that you could make some gains. So happy to answer any questions as we've envisioned it, but we have not identified a group yet. We have not predetermined any of the topics, so open to hearing what you all think about that. It'd be about 15 members, and we would hold monthly meetings in order to help them come to some suggestions for you.
I have a question. Is there a reason why you picked 15? And then, is it going to be based on data that we already have from public health groups? Where we're going to pull data from, and then if we have data that's not an equal distribution of the entire state, what are we looking at making recommendations for if that data is not what we need it to be?
Well, so one, I picked 15 because in my experience of convening work groups, in order to get the balance of kind of expertise, so someone in recovery, someone who has experience with public health, that's a more manageable number to do that kind of work group with. So it's not a hard number, it's just my experience of forming work groups. And I think what the group we would like them to come up with is, what is the mechanism for that investment as well. It could still be a publicly available grant opportunity. It could be a competitive grant process, or it could be something that the commission says it should go to these types of organizations. We don't have a predetermined outcome. The goal would be to spread it through the entire Commonwealth so that it would be an equal opportunity, it would be hitting all parts of the state. But again, nothing like specific, but that would be what we'd be running them through this exercise of how would you distribute that money? What would that look like? Is it a public grant opportunity, or is it a determination that it should go to certain types of agencies and that is decided by the commission? You have the authority to give the money out in a way that's not the grant process. So that may be part of the recommendation.
Just one thing I just want to add also is that, again, the formation of that group allows for, as been come up in multiple conversations, for the information to be reviewed by the commission. It's not a mandate that the commission has to follow that. It is simply going to be a recommendation from experts on opportunities to expand these things. So again, you're not talking about having something thrust upon you. It's having an opportunity to make sure you have these things outlined for you. And that puts it in the hands of a group that doesn't have to necessarily be the commission members itself to do
was just my question, is so ultimately, this group would make recommendations to this commission,
Yes.
and anything that came out as a targeted funding priority would be voted on by this commission.
Yes.
That's correct.
This is Trish. Could you provide a little more detail about how you're thinking about selecting individuals, these 15 individuals to serve in this advisory capacity?
Yeah, I think our intention is to reach out to each of you and see if there are experts that you think would add a voice, but we've kind of created a list of types of people, right? So somebody in prevention, someone who has treatment, somebody who understands change management, right? Like how investments might actually move a needle, somebody with lived experience. So just trying to think of all the people who have a stake in this area, but are not necessarily people who are currently getting grants or sitting on the commission, but are rooted in the science and the data and the expertise to help identify a needle. So we'll be kind of canvassing those folks, you all as members, but also, our partners at behavioral health and other, universities and places that would be willing to dedicate the time to this mini project, because it is a time-consuming effort to meet once a month for the next 6 months and try to come up with a recommendation.
Trish, does that answer your question? I mean, one thing that we want to make sure is clear is that, we're looking, as Jesse said, to have people whose interest is in the public health and expanding those opportunities, and that's really the focus of those who would have to join the work group.
Trish, did you hear that? Trish, did that answer your
I did.
question? Okay. All right.
Yeah.
I couldn't tell if you were frozen. So that's what we're proposing to do in advance of this time next year, so that they would complete their work as you're heading into your priority setting for the next fiscal year, so that it would, and again, you would not be bound to it. I envision it as, here's a couple of options that we've discussed. You all could choose one of those options, you could choose none of those options. But I think it's an exercise in trying to figure out how to do something strategic that is focused on a more defined area of investment and moving things forward.
Do we have to, are we to make a decision on this today, or we are going to think about, vote on?
We're asking you to let us know if you think this is a bad idea and you don't want to do it. We'd like to know that today, but
Yeah, it doesn't require a vote on, but what we do need is clarity from you all if this is something you're comfortable with or not. So that's the piece of what it is, because we're not asking for movement on money or anything that's going to be done in terms of policy change, but we just want to get a sense on whether or not the group is comfortable moving forward with that direction and have that brought back to you with some recommendations at a later date.
Is this sort of thing allowed with dollars like this? You can set up these kind of initiatives with these types of funds? We'd have to change the policy thusly?
the commission can create a work group of any type that they want without, that's in your purview. At this point, we're not asking for the spending of any funds related to this work. It would be a staff generated meeting. I think our meetings would be held in public because it's a work group of the commission. So it would be conversations around, hearing presentations. It's like a mini LRC, Legislative Research Commission, having hearings around these topics and then proposing some legislation. That's the model we're kind of looking at. But at this point, it wouldn't require any use of funds, and no funds could be spent until the commission agreed on doing that.
And the end goal is to reduce the work on the commission staff, or to be taking more applications?
It actually increases work on commission staff, but it is in order to help figure out a targeted way to spend some of the funds in terms of how we are going to use this money long term. And we've heard from you all and from the public that there is some interest in, you know, maybe other options besides just an open competitive grant application as we've had so far.
Yeah, Paul, one of the things we're really just trying to get to before we commit the resources to go down this path, to make sure that the commission is comfortable with us doing that. And again, there's no requirements or ask of the commission, but again, it will require a lot of work and effort, and so we want to make sure that the commission is comfortable with that. It's something that's been brought to the commission, and commission members have mentioned looking to have the ability to help look at directed and targeting, and this is the way to do that. And so that's really kind of answering the bell that's been asked of the commission staff before. So again, we just want to make sure the commission is comfortable with it before we start going down that path of a lot of work.
I don't really see the downside of having more eyes look at statewide problems and having targeted solutions. The commission still has the ability to vote or not vote for a project, so I can't see the downside to it.
I'm just trying to clarify. I'm a little, I guess I'm just unclear what's actually being asked. So we would set up a separate group to look at investments in ways that'll move the needle.
Well, so for example, if you think about how Kentucky invested in treatment bed space over a period of time, it resulted in more treatment beds in the state, right? Because they made targeted investments in ensuring that treatment beds were available, and they worked on policy issues. This group would look at all the issues facing that we face because of this crisis, and they would say, for example, and I'm just using this as an example, if we could do primary school education prevention, and we invested in that at a certain level, what would that look like? What would that require? And how much of these opioid funds would that take? So you might then, as a commission, say, this work group looked for 6 months at a lot of issues and said, if we could invest X number of dollars annually in primary school prevention, we could potentially reduce first-time use by a certain number of percentage with a strategic investment. So it would just be an opportunity to look at where some of these dollars could be used in a specific area of need. And it would be up to you to determine whether you wanted to funnel that money into that particular need or not. I would also say that we have thought about this. It would not change at all our ability to do the grant application. So we would maintain the grant application, but it would allow us to use a portion of funds in a more targeted way for some period of time. And that may change over time. You know, we may do that for 5 years and then move to another topic. But it would give it would have experts looking at it to make a reasoned and well thought out decision that is not made by, you know, just a small group or 1 or 2 individuals on staff. It would be a work group that you all have endorsed to look at it.
Mm-hmm. So for instance, if you put people in more beds, they're less likely to be out in the streets and use. So then you would look at homelessness, you would look at those sorts of things. Is that what we're saying? If you keep kids in after school programs, they're less likely to use first time. If you address parental issues in children's homes, they're less likely to use. Those sorts of things we're talking about?
Yes. And
those sorts of things would be looked at to say where you can make the most dent, if you will, in reducing either treatment or prevention. Is that what we're talking about?
Yes. Trying to identify one of those types of areas that we can make a dent in by investing at some level.
Mm-hmm. Do we risk going down a slippery slope with that? Because there are a lot of people who take the position on several sides I just stated and say if you had more, I don't know, stable parent in the household, they would be less likely to lose. If you got them a vehicle, they'd be less likely to, they'd go get a job and go to stay steadily employed, do we risk going down a slippery slope? That's all I'm asking.
I mean, my thought is that's what this committee would do, would we weigh those issues, look at what the evidence suggests, look at public support, so that was just a hypothetical, right? There's no preconceived notion at this point what this group would come up with, and I like the idea because moving it one proposal at a time is a way to make change, but say we identify an issue that might require some coordinated response or statewide response, that gives us the option as a committee of accepting that recommendation and then issuing some sort of different targeted funding approach. No commitment, but it's another way. For example, like we have a research and innovation NOVO out right now because we also want to extend the impact of this funding. So this gives us more opportunity, and I support it. I think the key is the membership, being representative of enough folks, and I like the diversity that you have planned for the representation. It's just that would this committee have a chance to at some point charge that group and approve the membership, or will you see that membership?
We would be circulating that to you all to make sure that you're comfortable with the membership, and if we're missing some key component of the membership, we would be circulating to get your feedback on the membership, and we would not announce that membership until we're all comfortable that it is a representative group. So we are open to making sure that everyone on the commission is heard on that, and so that we can convene the right group, because you're right, if we don't have the right group of people willing to spend the time to do it, it's not a very useful activity. And we would be charging them with thinking about the greater good, right? The public health impact, the overall picture, because everybody we don't want to put 15 people in the room who are all advocating that their own organization get the funding. That would be beside the purpose, right? So we're trying to create a group that would be balanced, that would be from across the Commonwealth, that would represent different constituencies, so that they have a voice at the table.
Well, I think you have a key point you said across the Commonwealth, because you don't want to have someone in a certain area and no representation over here. Are you going to look at statistics with that group? I'm not asking you. Would that group look at statistics monthly turned in with community, ASAP meetings, and where they gather what's a need in the area?
I think we would rely on our statewide partners like KYOAAC and those folks that do a lot of good research to try to give us the data that we need to help make decisions. And again, I think there will be potential for people to say, okay, this should result in a specific grant opportunity for this topic, or it could be some other type of investment. But there will have to be some regional differences. Even prevention is different, right, in every part of the region. But I think trying to identify one particular area where we could see some movement is something that is worth exploring.
Dr. Rupa, I haven't heard from you. I just want to make sure we get an opportunity for you to weigh in on this.
Yeah, I think that, well, sorry, Vaughn. I was just going to interject that I think it's, if we can get more people to the table, so to speak, to kind of consider their viewpoint, collaboration, and some of the strengths, I think having more lines of visibility is always important. And I think that this initiative is at least worthy of further exploration. So yeah, I've heard some positive benefits that could be delivered throughout the state through this initiative. So yeah, I'm glad we're not taking a vote today, but I'm so far to this point an advocate for doing things this way.
I guess I have questions about why the need, and I don't know. I'm not saying there's not a need. Where this came from, why the need, why now. Moving the needle means what? And of course, I'm going to go back to the data that may be hearkened on. Not enough data across the state, and I don't know for sure, but data across the state to make sure across the state to make sure we're including various groups. I mean, we all did those town halls where different groups are represented, but we honestly know that a lot of people are not applying for grants or don't get access to it for whatever reason, or feel intimidated by it. So the data we're pulling from, we have to make sure we're pulling in other organizations that bring in the data that we may or may not have in front of us. So those are my questions. Why the need? What do we hope? And can we adjust the groups? Let's say we go with one group and move the needle in one area. Will we pivot? Can you get results within 6 months or even a year? What are we looking for? So, I mean, these are questions that could be asked later. I know it's a lot. It's
Well,
just,
I think
you know, when I'm first hearing it, those are the questions that pop up in my mind.
No, I agree with you, Vaughn. I think there are a lot of questions on what they'll review, what they'll find when they're reviewing. I think the need is sort of what you started with in articulating. Right now, the commission only gets what comes to them. They are only getting what comes to them in a grant opportunity. And there has been a lot of discussion around how do we maybe think about pushing funds out in other ways, because we're now just subject to what comes in through the grant proposals. And if people aren't putting in grant proposals, or, you know, if we get 5 primary prevention and we get 5 treatment, that's what we get. If that's what you can only react to. And this is a way to sort of give you some options on some proactive decisions around deciding where funds can go. So it's not an either or, it's a both and. It's a continuing to have the grant opportunity, but an opportunity to look at where could you maybe make some proactive decisions around areas that have some evidence behind them that could use some support. And again, no decision has been made. The committee would have to look at, well, how do you make those funds available in that area, right? It's not, it could be a grant opportunity or it could be something else, but that is something they have to think about. How would we do that investment over what period of time?
I would like to say I support the idea. My strength is not creativity and innovation, and I feel like we could get some good ideas that may be a fresh set of eyes and some things we're not missing. I don't think we're obligated. I'm not picking up on that, but I'm certainly in favor of listening to what other experts would tell us that we're missing out on, because I want history to be kind to us and say that we spent this money appropriately and efficiently. And one of the things that I talk about a lot, I want to make sure we're covering every part of the state, not just 3 or 4 counties. And I think it sounds like, at least in what you're telling me, Jesse, that this committee, this advisory committee, could probably help us know some areas that we need to be noticing more. So I'm definitely in favor of it. Sounds good to me, and I appreciate your work. Sound like you all been working hard since the last meeting, so I appreciate your efforts.
Just to make sure, but Mr. Weber, Mr. Fegan, I'm not sure if either of you have any comments, but I want to make sure we don't decide if we can everybody contribute.
Do we have examples of other states' commissions that are doing something similar to this?
Well, I know that some of the states, so for example, in Colorado, they made a decision to spend a good portion of their funds on infrastructure, right? We currently don't spend money on construction or other infrastructure. So they have a specific amount of money that they're doing just for infrastructure grants that their commission decided was going to be part of the fund. And Virginia, I think, has something similar where they have a very specific way that counties and regions could apply for funds that's different than a grant proposal, and it has some parameters around it. So I think there are some examples of states that have set aside a certain amount of funding for a particular type of investment. And so that's really what we're trying to figure out is, do we need to set aside a certain amount of funding for a particular type of investment over a particular amount of time?
Thank you. That's helpful to know.
Just to add to that, also, so last week I was at a Samson conference where this specific conversation took place about Appalachia and what you could do along these lines about strategic lever pulling and how you do that with the collaboration of partners is something which is being discussed not just here, but the opportunities and the benefits of it are something that's seen by other agencies and by the federal government as well.
So I think the only other thing related to the next year's grant application, Hallie's gonna just highlight some changes we're gonna make to the application so that you're aware of that. Can everybody hear me okay? Everybody on mute?
Yeah.
Can
You may have to speak up, Haley.
Can you
Sorry.
hear me now? Is that good? Just talk really loud. Hello? Can anybody hear me?
We heard you that time.
Okay, sounds good. So, the staff have talked about some changes that we'd like to make to the application in order for the commission to have a better idea of the agency that is applying for the grant. And we have about 5 changes, so I'll run through all of them, and you guys can let me know if you have any questions about these changes. So the first one is to add more detail to the sustainability question that we ask in the application. We currently don't have much detail put into sustainability and how they plan to fund their project long term. This is a question that many of us ask. How do they plan to continue their project once their opioid abatement funds are no more, or once their award has ended? So we'd like to ask them more specifically, what kind of plans do they have to continue sustaining their project once the opioid abatement funds, their contract is ended? The second change is to ask them more explicitly about their project timeline. We don't currently have a question about timeline in the project. We have a question about plan of action, but this would be more detailed in them telling us, when will you have staff members hired? When will you purchase certain equipment? It will give us a better idea of how feasible their timeline is for their project. The third question is around recovery-ready communities. We would like to ask them if they live or if their agency is located in a recovery-ready community, and if it is, how have they contributed to that recovery-ready community process. And that's just to give us a better idea of the community they live in and how collaborative they're being in that. The fourth thing we would like to add is to be more specific about any loss of funding that they've had. We asked a lot about their finances in the beginning, but as we know, there have been a lot of losses of funding federally, locally, and across the state. So we'd like to be more specific about if they've experienced any of those funding losses and how it will affect the project that they are proposing to us. So not necessarily their agency as a whole, but if they're proposing a project to us that has been impacted by some funding loss, we would like to know about that. And then the last change that we're proposing is to ask them more specifically about what geographic area of the state the project will impact. As we know, a lot of us wonder at the end about the data, how many counties were impacted by this project. And right now we do currently ask about where in the state their project serves, but we're going to ask them specifically if they can give us the top 5 counties where the most clients are being served, so that whenever we look at the end, we can look at a map and say, this grant project helped this part of the state, this grant project helped this part of the state. We're aware that many of the projects may allow participants from every county, but most likely they're serving a more specific part, which is where they're geographically located. And I believe those are all of the changes, if any of you have any questions. And hopefully I was loud enough.
Seeing the yes,
No questions?
is online.
Yeah,
All right. All right, with that, we're gonna just move on to some of the, new business that's going on. First and foremost, the request for website phase 2 funding. As I mentioned earlier, the University of Kentucky has done an outstanding job in upgrading the capabilities of the website, the existing website, that the commission had, and that has now been upgraded into a way that it's current, it's practical, it's useful for people. We are now able to utilize it for the local reporting to be as an intake portal for local reporting for counties and municipalities on the use of their funds. And so that has become very helpful. As we talked about when the commission gave demonstrate and be able to be viewed in a dashboard type setting to help make sure that it's clear for anyone, not necessarily the commission or staff or somebody, but for any citizen to be able to actually go onto their, use it as a dashboard function, identify their community, see what resources have been utilized, where the funds have gone and how they're being utilized. To make that upgrade and those changes will require developmental work. It will require a data specialist to come through and to take some of that raw data that we have and be able to put it into a geographical, accessible, comprehensive opportunity for people to really access to get to those things. So we've got somebody on from the University of Kentucky, Lindsay Hammerstein, if there's any deep questions about it. But what we're really looking to do is to ask the commission for $310,000 to support the development and the expansion to the next phase of the website. Again, the key piece will be that accountability and access for everyone to be able to get to and use the information that's on there. So I wanted to put that out for that good message to staff. If there's anything else I missed that's critically important for the commission to know.
That's also includes our grants. So it'll be local reporting and grants that we give out will all be on that dashboard. So you can see approved applications as well as any report filed by a local municipality on how the money is being spent will be available.
Any questions from any commission members?
A comment. The number one question I'm asked is, what are the counties doing with the funding that was allocated directly to them? So a usable, publicly available site that actually affords a citizen the opportunity to see what their local government is doing, to me, is a very valuable tool. Because I think that's one of the concerns we all have is, and I know a lot of work is going on into that accountability. And if the effort is there, we should share it and make it transparent. And I do understand this is expensive. We hire data consultants managing web and active data, and using software is expensive, and so I do expect that this won't be inexpensive, but I think a very valuable tool for the public and for the accountability that this commission is expected to exercise.
Thank you. Anyone else?
What was the dollar figure again? I couldn't quite hear.
$310,000 is what we're asking to be set aside for this work. And again, that will move us through the course of this fiscal year. We can anticipate that we may see some things later on that need to happen to further this if need be. But we understand this will get us to a portion where we'll be able to have those in the Commonwealth to be able to see the things that they can pull forward in a meaningful way.
I make a motion, we approve the $310,000 for phase 2 of the KYOAAC website.
I'll second.
Any discussion? All in favor? Any opposed? Any abstentions?
I abstain.
With that, the motion passes. Thank you very much for that. Next on the schedule is the grant extension request, and as indicated earlier, we have a grant extension which kind of exceeds what the administrative work that we would normally do as a commission staff. So I'm going to ask Haley to explain this one, give a little detail on this background also.
The Wanda Joyce Foundation has already received one extension. They're asking for another extension to extend to June 30th of 2026, the end of the fiscal year. They had a lot of trouble hiring a staff member. These are issues that we've talked about all day, is how difficult it is to hire staff. But we did a site visit in July, and they're doing really great work. They have hired a staff member now. She seems to be fitting in really well, and so if they have an extension, they can continue to implement the program.
So with that, we'll be asking just for the commission to grant that extension request. Again, as stated, they have made the adjustments as necessary, have the ability to do that. Are there any questions about that before we move forward?
I move that we approve the extension for the current proposed the Wanda Joyce Foundation to June 30th of 2026.
Can I get a second?
I second.
On the motion is second, any discussion? All in favor? Any opposed? Any abstentions? The motion passes. Thank you very much. That concludes that, I will open it up to see if anybody has any announcements or anything that they feel is important for the commission to hear. Seeing none, next order of business is adjournment. So I will ask if I can get a motion to adjourn.
Make a motion.
All right. And a second?
Second.
Motion made and seconded. Any discussion? All in favor? Any
Aye.
opposed? Any opposed?
Bye.
Bye, everybody.
A good day, everyone.
Motion passed. Thank you, everybody.